Good morning, everybody. I am Dr. Selva Pandian from Chennai, practicing for the past 30 years. And today I am going to talk about diet in diabetes management. If it comes to diet, immediately the question is what to eat is from the patient. That's going to be the challenging one even for the healthcare provider and the receiver. This is going to be a tough question. And AD also says that diet is a very integral part of in the management of diabetes. So diet is a very important tool which is very important in the management of diabetes, and at any stage of diabetes, at any duration of diabetes, diet is going to, that is lifestyle modification including exercise, is going to be a important and integral part of the diabetic management. And diet, you have to be taken into consideration all the cultural, socio-economic factors, the personal life, and the day-to-day activities also will be included. According to that, diet will be managed. And in the diet, it is the person's right for the diet. You can't change the diet. You have to call for a dietary recall of the patient. Then you have to modify according to the patient's needs. It is not that anything which we say that one size fits all. No. It has to be individualized, and it has been centralized according to the patient need. That's the important part in the diabetes management. And you can't give a diet chart that says which is already prepared without anything, without the patient's recall. So there should be a clear patient's recall, which will give you an idea what to modify and what to add or what to. And diet itself will reduce the HbA1c to the tune of 0.5 to 2.6. So that's a great thing, which even the OHS can't reach this level of HbA1c reduction. So diet has a very good reduction of 1 to 2% very easily. And in the diet, it should be modified in such a way there should be some visceral fat loss, that is weight loss should be there, and that is going to increase the insulin sensitivity. And again in the diet, the most important in the diet, the complete diet is carbohydrate, protein, fat, vitamins, minerals and fiber. This makes an balanced thing. So in the carbohydrate, they say 50 to 60, but across India, if you take north, east, west or central, the diet carbohydrate content is going to be more than 65%. So according to the patient need, that can be reduced up to 30% also you can reduce according to the patient's need in reducing the weight. And each gram of carbohydrate is going to give you 4 kilocalories, and protein also each gram gives you 4 kilocalories, and the fat which gives you 1 gram is equal to 9 kilocalories. Fat is a very condensed form of energy, and that's what you have high calories even for 1 gram of fat. But in the carbohydrate, that's a main source of glucose, blood glucose. So that has to be given in such a way that it contains all the whole grains and everything, which has more fiber. For each 1000 kilocalories of food, there should be at least 20 grams of fiber should be there. This fiber, there are two type of fibers are there, soluble and insoluble fiber. The soluble fiber is going to slow down your glucose absorption. So that's very important, which is present in the legumes, oats, barley and other grains, so and other vegetables. So soluble fiber is an important factor in reducing your slowing down your glucose absorption, whereas insoluble fiber is also important in moving your bowels. And lastly, vitamins are really needed, but it is not that you have to substitute for all the diabetics, no need. If they are going to take enough of vegetables and fruits and nuts, their vitamins is going to be self-sufficient. But in some cases, it has to be supplemented in sick patients or those who need malnourished patients and all, vitamins are there. And minerals, again, it's a very important mineral and trace elements. In women, calcium is very important. It has to be substituted in menopausal women and elderly women and elderly men. And again, folic acid has to be supplemented in pregnancy, lactation and in anemic patients also. So these are the substitutions where it becomes absolutely necessary, where we have to substitute the patient. Otherwise, vitamins need not be supplemented to all the diabetic patients. It is going to be there if they are going to take sufficient vegetables, fruits and nuts. And again, oil, which becomes a very important factor, and oil should be mixed. It should be, all the oil should be taken in specified amount. And again, we say roughly 500 ml per month per head. That is a thing. And if you are, because in the oil, no oil contains the right proportion of MUFA, PUFA and saturated fat, because that should be in the ratio of 1:1:1. No oil is in that. If you take olive oil, the PUFA and MUFA are 50-50 and 10% is the saturated fat. If you take palm oil, again your saturated fat and your MUFA is 40-45% and the rest is saturated fat. Like that, this is the proportion what you get in the oil. So if you use different kinds of oil and you are going to get a balanced PUFA, MUFA and saturated fat. And again salt, which is a very important thing, 2.3 grams sodium is been given, that is roughly 5 grams per day will be enough. And if you take alcohol in moderation, 2 for men and 1 for female. But in our Indian scenario, because we are having more of carbohydrates, again alcohol is not to be taken in moderation, only in the western part, because they take a carbohydrate content is very less. But in our region, that is especially Asians, we consume a lot of carbohydrates, so alcohol should not be there. If at all it is there, it should be in moderation. And again, if you come to the weight reduction, you only without your lifestyle modification, weight reduction can't be achieved. And weight reduction of 2 to 3 kg is also going to do a lot of thing. It is going to improve your insulin sensitivity, thereby reducing insulin resistance, and diabetic management is going to be very easily managed. So diet is a very integral part in the management of diabetes. So eat less and walk more. Thank you.